Good morning, afternoon, or evening, everyone. Welcome to the 2020 IFMBE Clinical Engineering Division Competency Webinar Series. The topic in this episode will be quality and safety, in particular, improving health technology quality and safety for patients and medical staff. We remind you that we have more activities to share. In June 10, we have a meeting partnered with clinicians, support clinical caregivers using reliable health technology. More information will be sent via the chat you have in the bottom of your screen. I am Fabiola Martinez, Biomedical Engineering and Management Professor at Universidad Autónoma Metropolitana in Mexico City, and together with Mr. Cheng, aka Alan, will moderate today's session. We are joined by Professor Nicolas Pallikarakis, Professor Dan Clark, and Dr. Michael Cheng. Next slide, please. The agenda for this webinar is as follows. After a brief introduction to the main topic, quality and safety, our panelists will present Q&As through medical device vigilance, innovation, regulation, and frameworks. Then we will have some minutes for questions from the audience. For this, you can use the Q&A section in the bottom of your screen. Next. Quality and safety in health technology is an essential topic in healthcare, since they have an intense influence on the outcomes of the several procedures on the patients and also on the staff performance. So we made use of the definitions of health technology, clinical engineering, and health technology regulation. In particular, this last concept emphasizes the importance of guaranteeing patient safety through medical devices. We also have strong support on very valuable resources as the Clinical Engineering Handbook, with chapters dealing with topics such as regulation and patient and medical device safety. Next slide. In addition to the Clinical Engineering Handbook, other sources represent an overview of the aspects related to quality and safety in health technologies, from papers presented in international forums to publications with high impact in the clinical and HTA fields. Next. The functions of clinical engineers and health technology managers in quality and safety are governed by the principles of leadership that are presented. These principles need to be learned by all practitioners to advance their careers. Next. Academy and government can work together to achieve satisfactory levels of quality and safety in health institutions. The case I present is a 15-year collaboration where the university and a national health institute join forces to offer solutions to the various aspects of safety and quality that arise in the hospital environment. The way to develop this collaboration was through co-directed projects where the strengths of all parties were used. The university contributing with the professor's experience in research and methodological development, and the institute contributing with the biomedical engineering department expertise and domain of the clinical field. In this case, a professor at the Universidad Autónoma Metropolitana and the heads of the Biomedical Engineering Department of the National Institute of Respiratory Diseases developed undergraduate and graduate projects where the students proposed and implemented solutions to health technology-associated problems. The experience gained in applying quality and safety methods and tools used in other fields, allowing to deepen and generate knowledge that can be extrapolated to other health facilities. The sample of projects listed show the various aspects that can be addressed from the perspective of quality and safety. This scheme has been very positive for both parties, since all involved obtain benefits. Most importantly, high-value elements are provided for the safety of the patient and the medical staff, as well for the quality of the functions in the institution. Now I welcome Alan. Please go ahead.
Thank you, Fabiola. Next slide, please. Hi, everyone. Welcome to attend today's webinar at this special time during the COVID-19 pandemic. Among all the routine tasks of hospital clinical engineering service, quality and safety is a cornerstone and an internal topic, which is the main theme of today's webinar. I'm Zheeng, Director of Logistics Service Department, which includes clinical engineering and facility engineering at the Children's Hospital of Zhejiang University School of Medicine in Hangzhou, China. My team is doing some projects aiming at improving quality and safety of technology for patient care. For example, as the slide shows, as a winner of IFMBE CED Best Manuscript Award 2019, the paper addressed alarm management project in my facility. Based on the survey and analysis of medical equipment alarm situation in ICUs at the hospital, several measures to reduce non-actionable alarms and address alarm fatigue are implemented. This is even more important and needed in fighting the COVID-19. Next slide, please. Khalil, next slide. Thank you. Today, we will have 3 subject matter experts to illustrate the best of quality and safety approaches and describe the most significant leadership principles necessary to achieve these results. Professor Nicolas Pallikarakis, Institute of Biomedical Technology, University of Patras, Greece. His topic is a QS, medical device vigilance system developed for Greece and the EU. Professor Dan Clark, head of CE service, co-director CHT, Nottingham University Hospital, NHS, UK. His topic will be a QS approach through a national CHT innovation center. Dr. Michael Cheng, global patient safety advocate, Ottawa, Canada. He will talk a global QS holistic approach through understanding medical device regulations and systems management framework. And dear attendees, please check the QR box and submit questions online while watching the presentations. The speakers will address them later in the QA session. Thanks. Now, let's welcome Professor Pallikarakis. Please, Professor Pallikarakis, your time.